Welcome to the Elevated Frequency Podcast. My name is Shannon Morse, co-founder of The Green Door Life. And in these podcast episodes, we are all about sharing new modalities, ideas, and techniques to elevate your daily frequency. And today I'm very excited because I have a special guest with me. I have Dr. Kate O'Connor, who is the owner of Harmony Plastic Surgery. Welcome to the show, Kate. So great to have you.
Thank you so much, Shannon. So excited to be here.
I'm stoked. I can't wait to dive into all these little questions that I have and really bring some insights that I wish I had known before surgery. I had surgery with you in January of this year. We are currently, if you are just listening to it, we are in 2025. I had surgery with you in January. I had rhinoplasty. It's something that I had thought about for 20 years, if not more. And I finally did it and I found you. And there's so many reasons why I chose you. But before I dive into that, let's kind of start with a little bit of an intro. I would love to start. How did you get into plastic surgery and what kind of led you to found Harmony Plastic Surgery?
Absolutely. Well, like how you found me is exactly how I want to be found. So our synergy just syncs perfectly. And it's one big reason actually how I ended up in this area of plastic surgery, which can be a pretty wide field, and how I led to founding my own practice. So as for those people who don't know, that becoming a surgeon is a pretty long process, right? College, med school, and then you do something called residency, in which you have finished medical school, you have your MD, your advanced degree, but you're not practicing by yourself. You're still like truly in that apprentice model. And you're under surgeons who are taking you step by step. They're the ones holding your hand, imparting that knowledge day in, day out in the hospital. So at this stage of my life, I was doing ear, nose, and throat surgery. And my favorite surgeries to do were the skin cancer reconstructions. I loved them because it was one, there's a lot of geometry in it. It's a lot of thinking and a lot of planning. There's a lot of conceptual things. You're just trying to imagine, how do I take this and elevate it for a person? So there's the actual technical aspect of it. It's fine suturing, it's fine details. It's beautiful. I also fell in love with this idea that you could take something that would be like potentially a stigmata or something that's really challenging for a person and camouflage it. So where they're no longer seeing it, or people in society never know they even had skin cancer and therefore aren't thinking about it. And so blending the two together just really became so natural. And once I saw that, I knew it had to happen. How do you end up in cosmetics or aesthetics where you're doing things like rhinoplasty, where maybe we don't have to? There's a big crossover, that same kind of just sense of identity of just a thing that distracts you or takes your mind out of the moment or out of the pictures with your group of friends. I see a lot of parallels there. We have one life, one body to inhabit and to live in. And so to have that sense of autonomy where no one has to change anything about themselves, but the option to soften or enhance or just make it where it's not to the front of your mind, I view something to be really valuable. So these kind of two parallel ideologies really led to me feeling like it's a field where I get to really know people and invest in their lives, and then take it a step further by founding a practice where I could treat people the way that I wanted to be treated as a patient myself.
I freaking love that. The last thing that you said is so necessary. I love when individuals are in a practice because they feel like there's something perhaps that might be missing that they get to feel in terms of how they want to be treated. I so resonate with that. I think especially as a business owner going into different businesses and having customer service and being like, yeah, that wasn't my favorite experience. And if I were to do it, I would probably do it like this. And being able to do that with something as intimate as plastic surgery or any surgery feels like I'm so fortunate that I found you. Very, very fortunate and happy that I waited until I found your practice. And then we had that beautiful synergy. Also love that you're talking about geometry and kind of like the beauty of it and the sutures and exactly what you're saying when individuals look in the mirror and they are consistently distracted by this thing that feels like they almost look in the mirror and they go, and this is essentially a feeling that I had, was that's not me.
Mm-hmm.
It's this feeling of mixed identity or false identity even. And I can see that this is a big crossover with people who are going through transgender experiences as well. They're looking in the mirror and they're like, this doesn't match what I feel on the inside. And what an incredible thing that we can start to almost like harmonize the inside and the outside in that way. It's pretty incredible and awesome. My next question around this is, a lot of people, when they think of plastic surgery, especially people that have not had it,
Mhm.
and this was my first time. And so a lot of the discovery, I was like, oh my gosh, this is so wild. But you take a more holistic approach. So, what does it look like for you in your practice, and kind of what are the ways in which you're seeing the evolution of someone's journey that might be different than traditional plastic surgery, perhaps?
Absolutely. It's exactly what you said. Like, I feel really blessed to get to have the name Harmony Facial Plastic Surgery because it touched on all the things I want. I want harmony in our faces. I want harmony in our mind, like body connect. Just like you said, it doesn't matter who you are. We all have things that we love about ourselves and things that are sticking points, and just trying to blend the two where we realize it's all part of the same human experience, no
Mm.
matter where you fall on that. Like, there are things that we all go through together, even if it's alone in our own minds.
Yeah.
So I felt that that was like really important. And then bringing that home is, I've also, like you said, the way you want to be treated, like just a sense of like, no, you're seeing me, you know? I think medicine's made a big gains and come a long way in getting away from like the paternalistic view of the 1800s, where it was a surgeon with a scalpel coming down to tell you, if you don't have this, cancer cut out, your life is ruined and you're done. And this is the only way it shall go. And we've come a long way to kind of get away from that, but I still don't think we've gone quite far enough, because
Mm.
like we said, if we're sitting there knowing our own body's best and being autonomous and having agency, it should be a shared partnership and a shared decision. And part of that comes from knowing all the things about me, not just like, for instance, in my world, not just what I look like, but like what's going on in my life. Is there a big stressor that I'm going to have to consider? A job change or a move across the country, or even a good thing, a wedding or a celebration that I'm kind of playing in the back of my mind of things and getting ready for.
Hmm.
It really is that 360 degree of what a patient needs. What's their nutrition status? How do they like to move their bodies on a day-to-day basis? Do they move their bodies on a day-to-day basis? What is an ideal outcome for you? Like, it could all change. Someone who is in their late 70s might just want to look refreshed and not have the same internal or external pressure as you, little cat. I thought it'd be less distraction in the office. Okay, so let's go back. So with that, someone in their 70s may not have the same expectations or even desires as someone who's in a different stage of their life. And it's just meeting a patient where they are. So the holistic approach really means considering that nothing I'm doing is going to happen in a vacuum. So none of our conversations should happen in a vacuum either.
Absolutely. I love that. And I'm curious because, and I'll share a little bit about some of the experience that I had because it was so surprising. I had broken my nose very young, and my father had this comment which stuck with me, which some comments do from our parents. And he was like, you don't need to fix it. You look like me, because my dad had broken his nose and his grandfather had broken his nose. And I had created some sort of belief in my system that said I was not going to be a good daughter if I changed it.
Yeah.
Wow, what a belief to have. And so I had sourced different surgeons in the past. Like, I had looked up, I had spent so much time and energy in my adult life thinking about it, not thinking about it, thinking that I want to, but I shouldn't, like this whole back and forth. And then about 4 days, and you and I haven't even talked about this yet, but about 4 days afterwards, I felt this release of like resentment
Wow.
and just like this sense of calm. Like, I had had an undiagnosed chip on my shoulder. That chip was like, I can't do what I feel is right for me
Mm.
because I'm beholden to a certain position as a daughter.
Yeah.
And when I change that, I'm actually noticing, and this is where it's so cool, these things that you don't even realize, I'm starting to notice a shift in just my overall relationships. And there's this underlying thing that was really attached to nothing in my current environment, but yet it affects everything.
Mhm.
And that kind of stuff, I am like, it's really powerful what you're doing.
That's
Like,
amazing.
you as a surgeon, like, and whether people have the same sort of experience or it's different, it's unique to themselves. Like, I got so nerdy when you and I were starting to talk about all these things, because wow, there's like an actual energetic and emotional transformation that people get to go through as well.
Absolutely. And luckily you're blessed where you can kind of have the training and the awareness and the space to recognize that. And a
Mhm.
lot of people luckily get to experience it even if they don't. But when you get to kind of see the two come together, like that's what makes me so happy. And it's such an honor and a privilege to get to have patients like you and all my patients though, to get to be on their journey. Cause it's transformative is the perfect word.
Yeah, absolutely. So what I love about this, and of course, I do a different type of transformation with the green door. We're helping people to really allow their inner blueprint to come out in terms of weight loss and overall health and movement and all of these things. Because I really do believe that we have a blueprint that we feel and can see on the inside, but we may not be fully expressing it and we may not even know how.
Totally.
So in that way, it's like such a cool thing because I could see the parallels so easily. And then going through the recovery process, I was like, oh my gosh, nutrition. This is such a big part of it.
Yeah.
So you provide like this really beautiful pre and post op nutrition guideline. And I was so stoked and I was so excited to get that. And then I started to geek out and even further and I started to relate it to strength training
Yes.
and recovering of strength training. And then I basically asked you if I could make some edits, and we started to collaborate on this pre and post nutrition profile.
Right? It was magical.
So magical. So, how do you feel and see that nutrition affects the body's healing for preparing and then for recovering for surgery?
Absolutely. I mean, with what you do at the Green Door Life in this podcast, it's kind of a little bit like preaching to the choir, but I'm just going to
Yeah,
give my spiel like I would to any other folk that I caught my ear at a coffee shop or something like that. But
please.
basically, nutrition, like as you know, is our building blocks. And I think we for too long we viewed elective surgery as something that again happens in a vacuum. You chose to do this. Most of my patients are blissfully healthy and kind of, coming with a good blueprint and a good starting place. But that doesn't mean then that their recovery happens different than any of the other body processes. So
Mhm,
one of the things I say in 100% of my consultations is your body doesn't know that you chose this. Your mind might, so we can get all those powerful shifts and unlock old beliefs or get to just create new ones for ourselves. But our physical being has no idea, and it treats surgery, whether we did it emergently to save your life or electively, like injury and illness. So
mhm,
having that background and using nutrition to make sure we're having it as a third avenue of medicine
mhm.
is really important.
Beautiful. I love that you say that your body doesn't know that you chose this.
It doesn't.
Yeah, it's like it's going to go through some things and you're going to have a conversation with it while it's going through that thing. So when it comes to like nutrition for preparing, what are some of the key nutrients that you see for vital roles in the healing, reducing inflammation, and just optimizing the overall results post surgery, pre and post?
Pre and post. So luckily we get back to basics, which is the most frustrating thing because it's like, oh my gosh, this again, the devil's in the details, and just getting back to basics again and again will always be what we need to do.
Mhm.
The number one thing would be just real food, right? If it can live on a shelf and has preservatives, it's not going to deliver the nutrients we need, no matter how zhuzhed up and how many organic labels they put on it, and ideally designed. So eating real food. That comes in, three flavors. It comes in fats, it comes in proteins, and it comes in carbohydrates. And trying to get back to those building blocks is what's going to set us up for success. So that's kind of like the framework that I want people to go in with. Then for someone like you, we can get into the nitty gritties of optimizing where you have kind of a working understanding of what your body needs protein wise, getting enough ounces of protein, having healthy fats. But what do we need in terms of the micronutrients and the elements and the minerals and supplements? And that's kind of, where experts like registered dietitians and nutritionists can be such good partners in this journey too.
Absolutely. Yeah. And so what I got to really geek out on, I love, first of all, that you're starting with whole foods. 100% yes. I don't feel like we can ever affirm the basics enough
Right.
of our macronutrients, our water intake. I felt so fortunate to know exactly what my body needs as a baseline for my nutrient intake, the amount of carbs, the amount of protein, the amount of fats when I am not preparing for surgery. And then what I loved about the initial document that you shared is the highlighting of this is not a time to reduce your intake. Not a time to reduce your intake, you guys. And I want to just impress that a little bit more because it's the same thing in strength training and getting stronger and building muscle. Our body needs an excess of intake so that it can build and recover effectively.
Mhm.
So when I saw that, and I can think of some individuals' brains, if
Mhm.
they're doing anything that is like reshaping, like perhaps it's liposuction or things like that, of course you don't want to overdo it, but your body is still in recovery and you need to have enough so you can heal properly.
Totally.
So that was a really, I've already shared with some of our clients who are going through surgery and we're supporting them with their personalized nutrition for pre and post op.
Love it.
What I also loved was the highlighting of protein
Mhm.
and also the different avenues of collagen.
Mhm.
That was one thing that as I was kind of diving in, realizing that we have different types of collagen, both that we can consume in our diet and in our body. And then as I started to look at the inflammation process, I started to realize, like, oh, again, it kept circling back to strength training. I was like, oh, wait. So this is why tendons take so much longer to recover, because they are avascular. They don't have enough as much blood flow. And then cartilage has the least blood flow. And so that inflammatory takes so much longer, which to me says that if you are recovering from surgery and there has been an impact on your tendons or your cartilage, you actually need to keep your nutrition protocols up for an entire year.
Wow.
And it can't just be a 6-week protocol,
No.
right? Because your turnover is still occurring. And when I started to go in and realize all of that and then create this document with you, I was like, wow, it's just so cool to think about the impact of nutrition on that surgery aspect and all of the different elements that are involved as well.
Totally. And it's so great to get to have conversations like this because even me, where I feel like I live in this world and want to take the most holistic and long term approach, like even I kind of have, I don't know if it's just like a burnout phase or a part where like, okay, we got it to a part where you're in homeostasis, like
Mhm.
I kind of got you back to baseline and even a shortcoming of myself to not see the parallel of how long did I tell you that your nose would take to go down a year, right? That it's like our old kind of just wives' tales and don't really have a reason why
Yeah.
we would always just blame swelling. But if it's truly exactly like you said, there is less blood flow. The skin is thicker. Like all these little subtleties that come together is really neat that it's all right there in the
Oh my
basic
gosh.
again.
Yeah, it's so cool. And this is something that I'm just like playing around with, looking at all of like the nutrients that are in there also, which are our vitamin E, our vitamin C. I thought it was really fascinating that some things you don't want to have pre-surgery. This is a little bit like off of some of our questions that we talked, but so it might be a pop quiz, but can you share some of the items that we want to kind of not have during pre-surgery and why the considerations are like that?
Of course. So, right. So, first off, is always going to be talk to your surgeon and your medical team. I
Mhm.
can speak for myself because I kind of know what my risk tolerance is. And if there's someone where I'm worried about their nutrition and their protein status and they tell me they're pescatarian and they only eat fish,
Mm.
I'll probably be a little bit more lenient than maybe a cardiac surgeon where if we're worried about omegas or vitamin E or things thinning the blood, where major bleeding is a consideration and we need to take that really seriously. So each different surgeon is going to have their own appetite of complications that they're looking to prevent and what their risk stratification is. So always start with your medical team to,
Mhm.
and knowing your health history too. The biggest thing though is to kind of go back is we kind of were harping on real foods. I
Mhm.
love that you reminded me my own, adage of just not a time to cut calories. Your body needs every little thing like that to bring it back to your weight loss or fitness and strength building thing. Like, in a catabolic state, if you're trying to build muscle, how in the heck is it ever going to make sense if you're in a caloric deficit? You just
Mm.
can't.
Mm-mm.
And then you can get in a self-perpetuating cycle where you're losing protein, you're losing muscle mass, your immune system's down, you feel worse, you're losing more muscle mass, and then away you go. And it just spirals. So I would say anything that's going to be a low fat, like, or fad diet, where like, luckily we've kind of gotten away from the 90s, but where it's going to be a no fat yogurt or anything where you're like, hey, we have potential for a lot of sugar in there being very
Mhm.
inflammatory without much fats or protein to balance it out.
Yes.
Those would be kind of some just generalities without I stepping on toes or putting in too much of my biases when an individual surgeon may have their own dietitian on staff who could help their patients.
Absolutely. I think that's a really effective answer
Cool.
because there are so many considerations and so many different types of surgeries.
Mhm.
And with each type of surgery, not only do we have different types of tissues that are being worked on or organs, and therefore it would require a different strategy for all of them based on all of those considerations. Also, someone's health history and anything in that area. So I love that you gave a general answer because that's very responsible.
Yay.
And moving to basically talk to your surgeon because everyone's going to have a different idea and a different plan, and that the basics of hydration and whole foods and all that stuff is going to be always applicable. There was something that I wanted to share here that was part of our conversation, your and mine. And that was when I first went through some of the information and it was talking about the pain medication and the optional of antibiotics and things like that. And you and I had a conversation. And of course, my background, I was raised Christian Scientist. I was born at home. And so I was looking at it and was like, wow, my body's going to be like, woo, it's going to be having an interesting party. So I was like, what here is absolutely necessary and would you recommend?
Mhm.
And we kind of went through the list together. And in that way, what we chose, and I'm going to say we because we were in that tandem communication. And I love that with your surgeon or your doctor, whatever you're doing, it should be like a joint conversation that is open to back and forth considerations. I asked kind of, do I need to take antibiotics?
Mhm.
And your answer was not necessarily unless we see a sign of infection. And I was like, oh, okay, great. And I didn't even realize that I had an option.
Mhm.
So I think just having that kind of awareness, and every surgeon is going to have different protocols and it's going to be different types of surgery. This was not a super, super invasive one, so it may have less risk factors. But is there anything else that you feel comfortable sharing kind of around that topic when people are having the initial conversations about pain meds, about antibiotics, steroids, that sort of thing?
I do. And I can even do you one better and tie it back to what we were talking about nutrition. So
Yay.
it's like I said, we all have our different preferences, but at the end of the day, I truly believe that you know your body and having a partner who's walking next to you is going to be what sets us up for success. So in
Mhm.
that instance, to tie it back, if you're not getting the answer is not necessarily that you want, because sometimes the right answer, the answer we need may not be the answer we want, but an answer that ultimately isn't in your best interest, you have a right to ask more questions and to dig deeper. And so if you talk to your surgeon about nutrition and they kind of brush you off or not take it seriously, there are resources out there. There are coaches on Instagram who devote their lives to this, obviously what you do, Shannon. So there's all of that going in the background.
Mhm.
And then I view that too as the same thing of just risk stratification of people are smart. They can know what they're willing to tolerate and what they aren't. So I probably have some patients where I'd say there's a 1% chance of infection in your nose. And if it happens, here's what could go wrong. Your
Mhm.
cartilage could die, this and that we could go. And there'd be some who'd say, I'm good. I will take out all the drugs. I don't want to skip a thing. Here we go.
Mhm.
Someone else could look and say, oh, you mean I have a 99% chance of never having to worry about this ever? And that means I don't have to think about my gut biome and constipation and all of this. I want to take that risk. And both are okay. We
Yeah.
just dialogue to know how to plan for it. Because then you can say, okay, I don't want to take the antibiotics. What do I need to look for? And now
Mm.
you're empowered to start being proactive of like, hey, is this normal? Is this not? And we can head things off earlier.
I love that answer. Yes, I love that answer because it's exactly how we go through coaching experiences where, again, we're not looking to vilify or make anything right or wrong.
Mhm.
We're just like, what is your unique situation right now? Where does your comfort lie? What's best for you with all of the factors considered? And then you get to make an empowered choice, understanding the implications or the impact in either direction.
Absolutely.
Yeah, it's so good. I so love that. And I really felt in our conversations, I really felt like I could ask you anything and you would be like, here are the options. And I'm like, great, I get to choose with those. Thank you. And there was never a, I would recommend this or I would recommend that. It was always very neutral and just allowing me to have a choice. And that is so powerful. So powerful.
I
So
know.
thank you for
Yeah,
that.
thank you. And it can be hard because every now and then a patient will come in and that'll be very stressful to them, right? To
Mhm.
have feel like they have, well, should I do it? Should I not? And then I'm happy to lend an opinion of like, okay, if like an experience share. If I were you, if I was in your shoes, here's how I would act. But just to not have to view so black and white or even just like, yeah, rigid of like, let's actually like think critically and what do we need here versus
Yeah.
just like, this is the way it's done. Here we go.
Right. Absolutely. And I think that's really common in our medical space, specifically, where we will either medicate for whatever it might be before actually understanding if there's other options that
Yeah.
would allow us to not have to medicate and then perhaps not have to deal with the other repercussions that happen due to that medication in whatever circumstance it is. And then also understand when it's really important to medicate.
Yeah.
I remember asking the anesthesiologist about some of the pain meds, and she's like, "Take them."
Yeah.
And I was like, "Okay."
Yeah. Exactly.
Great. I trust that you, who is about to put this stuff in my body, and you've done this many more times than I have, I'm going to do that. so, okay. So let's kind of move through the nutrition component and into just considerations for movement for
Yeah.
individuals and kind of ways that sometimes patients might be nervous about, I mean, at least in the field that I'm in, they're nervous about maintaining their metabolism or their fitness levels while recovering from surgery. What do you kind of share with individuals that might come to you with that kind of thought process?
Absolutely. I mean, one, usually I share that I'm grateful that they're in the body that they're in and considering that, right? Because if that's where you're coming from, that means we have a lot of room to work with and a lot of optimization and planning, rather than someone who may be more sedentary and we're just trying to get them moving in general, something like
Yeah.
that. So if it's a true fear, I was kind of trying to think of an analogy, and I'm not a marathon runner, but I was a swimmer, and there's enough parallels where I'm like, I think I can pull this one off. And so, kind of like surgery, like I said, it's like with a little bit of a caveat that I think your folks will stick with is, yes, it doesn't happen in a vacuum, right? But at least for your body, but your mind can kind of view it as a standalone event.
Mm.
And just like getting ready for a race, there are things that you do in your training program in your life that don't show up on race day. You treat race day separately.
Mhm.
And kind of the same thing for surgery and recovery, that like if you're someone who fitness and strength training, all this is a portion of your life, that foundation is there. But just like on marathon day where you wear different gear and you arrive at the race and you're prepared, it's going to look a little different and you're going to act a little different. So in the immediate recovery period, treat it a little different. This is not the time for like perfectionist fantasy. We're like, okay, great. I did this life-changing thing for myself. And this week I'm also going to eat perfectly 100% of the time and never miss a workout and reorganize my closet and, because I do think those kind of habits all tend to run together. Um, so just to give yourself grace, because what have we highlighted? You're in a caloric deficit purely from healing.
Mm.
Your immune system's taken a hit because your body doesn't know we chose to do this and it thinks you're recovering from an illness. And just like at the gym, gentle movement can be great, but you're not going for a PR the day you got your flu diagnosis. Kind of the same thing of just
Mhm.
like, we want to keep moving your body, knowing that if we can take care of yourself now, we'll get you back to your peak fitness faster than by piling on and doing too much too early. And so it's a teeter totter a little bit.
Absolutely. Okay. Thank you for that. And I'm going to add to it with the experience that I had because with that kind of guideline, and I hadn't had surgery prior to this.
Amazing.
When the week that was directly afterwards, I did not move the first day at all. I was enjoying that with a little gossip girl. And then the next day, I have a walking pad, and I think I was walking at like 2 miles an hour, just like gradually. And that actually felt like doable. I felt like I had very low energy. And the next day it was like 2.5.
Mhm.
And I slowly increased it, and I could start to notice my body and my mind going on day 5, like, I wonder if we could do like a light workout. And then I was like, no, we're not going to. Not going to, because in my certain circumstance, it was at least like 2 weeks before you start to do anything that is weight loading or bearing load in that way. It specifically, and you share this with me, but specifically prioritizing walking because of the lymph flow, because of reducing inflammation, because you still want to get blood flow through your body and your system. So that's a really important piece of the puzzle, but yet not causing further inflammatory responses like strength training. Obviously, with this particular surgery, you don't want to have your head down below your heart because it'll cause further inflammation and having undue blood flow to the head and the face. But just understanding that we want to get blood flow, but we don't want to cause further inflammation.
Mhm.
I think just understanding those two pieces, I was like, okay, great. I can actually now readily, plan a progressive movement practice for individuals who are now recovering from surgery based on the experience that I was able to have, which was pretty cool. I mean, I loved being on the inside, getting all of like the firsthand details. I was like, okay, I know exactly what's happening here. So in that way, I'm kind of going to move us through into some of these next questions. When people are finding a surgeon,
Mhm.
like when they are looking for a surgeon and they're looking for someone who can have a holistic approach and have in mind like a whole body healing modality, how do you think individuals should go about searching for a surgeon that would have that kind of practice? And
Yeah.
is there a way that you're aware of?
I'm certain that the ones that I think jump off the bat and kind of talk about it right there is kind of a self-flagging. I
Mm,
know just kind of poking around and colleagues who are just almost more receptive to it. You find your tribe a little bit. I'm sure there are some people where you can just immediately be like, oh, I help unlock people's blueprints. We plan a comprehensive plan where their mental state, their emotional state, their nutritional state, and their physical state are being taken care of. And you some people who their eyes light up and they like lock in, and other people where they just kind of glaze over and you're like, oh, we're not on the same page here. Same thing I would say with surgeons is one, if they're kind of advertising it or talking about it, right? It's the modern world. We talk about things that we want people to pay attention to and know and signal that it's a value to us.
mm,
The second thing is to just that gut check of like, is in your conversations, if you're asking, oh, what should I eat before surgery? And people are acting impatient or frustrated with you and you're getting a sense of that, probably not a good fit, that's maybe not a priority to them or even a consideration where they just haven't
mhm,
even gone down that road to wonder how it all works together. And the willingness to potentially change a protocol or not just go down the algorithm like we did when we were weighing the pros and cons of an antibiotic and what it would do to your gut. And, there are some people who, well within their right to say, nope, this is the meds I prescribe. If you don't want to take it, we're not a good fit. And that's
mm.
okay. That's why it's a big wide world out there. So I think that there's kind of just that gut check too of how is the conversation going?
Awesome. I mean, it's not dating, but strangely, it's kind of like dating.
Yeah, it kind of is at the end of the day. Like, hey, you're wanting to make it like, do I like you? Do I enjoy you? Are we a good fit? Like, can you take? Yeah, exactly.
Yeah, for sure. As I'm hearing you share some of these things, I'm like, you don't want it to be all about, do I like your
No.
personality? You definitely want people to feel. I think one of the main things that I was actually feeling into was confidence.
Mm, yeah.
Like how you responded to questions was incredibly confident. It wasn't like, it wasn't like a wishy washiness.
Mm,
There was actually no wishy washiness at all.
pretty
You
nice.
either like knew exactly what to say, or you're like, oh, that's something I'll consider.
Mhm.
Or, we don't really have to think about that, or whatever it might have been. I love what you're saying about gut check. I love what you're saying about just having conversations and even like picking out the things that are a priority for you.
Yeah.
Like if you want support with nutrition, if you want to have like an understanding about some of the emotional components and have your surgeon understand that as well. If you want to be able to like further collaborate about like the design and whatever that might be for you. And then seeing what your kind of top priorities are, your non-negotiables.
Again, yeah, perfect dating. You're right. But it's all right there. Cause like, luckily, again, I mentioned that, we're on social media. Our work is there. So if a surgeon's, aesthetic gravitates towards you, particularly in my world, I don't know about hip surgeons, but they probably have their own things that they kind of publish. It's
Yes.
all right there. And especially in aesthetics, our work is out there. So there's that initial gut check of, is it an aesthetic I like? And the proof is in the pudding. Like, it's really rare for surgeons to not have portfolios of people to show you and things to at least be like, hey, this is how I see faces. And does this jive with how you see your face? So we have that too, almost like a love at first sight thing. And then you can kind of get to the experience that this person has matches experience that I've had or would like to have. The way they communicate matches. Like, so it's kind of all that blended together.
Totally. I love that. Yeah, absolutely. I love that you're actually pointing to the aesthetic, because different surgeons have different aesthetics. It's like there are different types of artists,
Yep.
and this is an
Absolutely.
art.
Yep. Exactly.
This is truly an art. So how your artistic expression works with someone's tissue is going to be very unique and specific to you and every surgeon. So I love that you pointed that out. So as we kind of mentioned before, you and I got to collaborate on this guide for optimizing surgery recovery through nutrition and movement. And what is perhaps a surprising takeaway from the guide that you think some people may not realize about pre and post prep? And we might have already covered it, but anything else that comes?
No, there's definitely so much because it's almost like there's so many things circling your brain all the time, right? So one of the things that jumped out at me is you're exactly right. When I first sat down to make my pre-op, preparation packet for certain patients, because it is so overwhelming. I sat there and as you kind of mentioned, if you recall, go back, there's a section on zinc and magnesium and how those are needed for collagen formation and how vitamin C affects both our immune system and also precursors to collagen, and collagen's needed for the incisions and under, right? It all goes there. But then it's kind of like, okay, to then see all your efforts echoed back. It was like the most like, oh my gosh, all the praise and accolades to you, Shannon, because it was so cool to kind of see it parallel how you would counsel and coach, and just like seeing your twin mirror something back. So it was really, really exciting. So that was just like my first gut when we started the club was like, she get it. She's got it. She gets it. It's perfect. So it's so comprehensive without losing the forest for the trees. I loved that it could kind of get really tactical and have recommendations without being overwhelming. Because that is something where you're like, well, actually, zinc works because once it gets brought into the cell, like it gets phagocytosis. You can make it complicated and weird. And the things that shocked me and was a good surprise takeover is that one, it can be something where it enhances your life and doesn't take away, right? Getting ready for surgery is scary and overwhelming. And all of this stuff and the prep that you talked about isn't this draconian, super challenging thing that you'll never get to live up to perfection. And how dare you even try? And this is so overwhelming. It was really just like, hey, this is how you take care of your body. This is how you move your body. And I loved the parallels there. So that was great. I thought a special attention should go to focus on your sections on our sections on the probiotics and the gut biome, because that's an area, even for myself, that I know I need to devote more attention to. We know it's so important to the body, and yet how? A little bit of a black box of mystery. So I thought that was really insightful. And just knowing that like your expertise on movement, right? Because one of the things that you and I talked about is, one thing that I'm going to probably just work on counseling is a lot of things that I say is listen to your body. And you gave a beautiful anecdote of, well, you started walking at a slower speed and you were pretty tired. So you waited to hear your body tell you were ready. Well, what happens if that voice isn't so loud, right? You still haven't
Yes.
trained it. And so I liked for you that you had numbers, and we had numbers of aim for this much walking. And it really did just make it where, hey, it's a part of your life without changing everything.
Yes, absolutely. I love all of those reflections. And what you're saying about sometimes that voice is not as loud for individuals, 100% true, which is one of the reasons why, because I know that inside of our coaching, we are actually helping people to deeply listen to their voices that they don't even know are happening. Everything from hunger to energy levels to brain fog to inflammatory responses in their body to their energy levels, menstrual cycles, strength, like all of these things, our body's always talking to us. And it's even louder when we're sick, which is interesting.
It is.
So when we are under the weather, we have a flu, a virus, whatever, we're recovering from surgery, the body's language is actually much easier to hear. And so in those moments, we can actually tune in. It's just like the radio frequency is just higher, it's louder. So in this respect, I also understand that people will have the other voice, the logical brain that just pushes forward and says, let me reorganize my closet. And you get to be like, well, maybe wait a week and a half.
Yeah.
You know,
Pause.
yeah, take a breath, have some protein or carbohydrates, maybe. Um, and so I really do love that you're aware and you're pointing that out because it's so true. And yes, that's why having a guide that just gives general recommendations to start with so that the logical brain can essentially be pacified
Hmm.
so that it has a structure to follow and it doesn't have to go into the anxious cycle of guessing, am I doing this right?
Totally.
Which happens for so many people.
So many.
Yeah. And then this just gives like a, hey, these are the considerations that you can do if it works for you before and that you can do if it works for you after. And
Yeah.
that's
And that's it.
it.
That's a great point. I love your kind of separation too of our logical brain, because sometimes then it can pile on like judgment and shame of you're not doing enough, you didn't prep enough. Well, what happens? Sometimes surgery is emergent, right? And so
Mhm.
we want to just make sure people can be empowered and do the best they can without like having cortisol spikes because now you're beating yourself up because you didn't get 20 grams of protein at each meal for 6 weeks leading up to, all those different things.
Totally. And exactly what you're saying, the stress component. I can't stress that enough because what you're talking about, if we are going into it with an anxiety, if am I doing this right? Like whatever it might be, or if we haven't given ourselves like just a schedule to not have so much on our plate
Yeah.
afterwards, and that we are producing that high cortisol, that stress is the number one component for actually catabolizing muscle tissue. So
Yeah.
if you are compounding things like not eating enough and not allowing yourself the time to recover and not stress, then you're basically really compounding these issues that will further lead to inflammation and extending the recovery process.
Perfectly said.
So, I mean, thank you so much for bringing that up because I have had clients who have had whatever type of surgery they've had, and then they're going and like they're right back to work 3 days later and they have all of these things that are on their plate. I was fortunate enough and I had the foresight to take an entire week and not have anything that I had to do outside of administrative stuff that I could do sitting.
Hmm.
And that allowed me to feel very like my nervous system was be able to be in a calm state. I was able to digest my food. I was able to walk. I was able to get sunshine sometimes, like all these things in the freezing cold. So I got an ice bath also during that time.
Yeah.
And it was so great. So I'm so happy that you brought in the stress.
I know it is. It's so funny because I don't know if I shared this with you, but I've also had my nose done,
Oh,
and
yes.
our recovery processes were so different because I was in a phase in my life where pushing was the name of the game. So I was back at work 2 days later. I was in the OR with black and blue and cast on, and seeing how slow my healing was because of that pushing
Yes.
and not listening and just shoving it deep, deep down and just not giving myself space was the antithesis of what I would want for patients now.
Thank you for sharing that.
Yeah.
Because especially for women, I mean, a lot of our listeners are females, high performing females. And in a past scenario in my life, I would have been 100%
The
in
exact
your
same.
position. I would have just been pushing, pushing, pushing because I didn't understand that in order to build, I have to have a rest cycle.
Mhm.
And those things are like they can't be separated effectively. But it's so cool actually that you got to see the impact of not having that rest
Yeah.
and to be able to see the drastic difference for individuals who do have the rest and then they don't have the rest and then how that
I mean,
compares.
completely. Because I would like you. I was young. I would consider myself healthy and good shape. But like we've at your follow up, we've talked about how your definition in your nose is really good. My nose looked like a potato for like weeks, like months, because I just didn't listen and I didn't give myself time. It was horrible swelling and inflammation because I just didn't rest.
So I'm trying to think of how I would really like to wrap this up for our completion here.
No.
I think for anyone who is, especially in this area or beyond, that's traveling, for someone who's looking for a plastic surgeon like you, who prioritizes this holistic perspective of healing and who has this kind of um, I want to say like high vibe personality.
Yeah.
How can people find you? What's the best way?
Absolutely. So I am reluctantly on social media. I don't spend a ton of time there, but hoping to do more.
Mhm.
But my Instagram handle, everywhere handle is usually Dr. Kate O'Connor, KateOconnor. And then same thing for Harmony Facial Plastic Surgery. We are the only Harmony Facial Plastic Surgery. So that handle everywhere, as well as our website is just harmonysurgery.com. We're located in Nashville, Tennessee, so nice and central to a lot of folks across the country. I love my team. I want to give them a huge shout out. I'm so proud because they really believe in the same ethos and values that I do.
And I really got the sense of that. Everyone has been awesome, and I really appreciate your team.
Of
And
course.
I want to make sure to cover this because I'm also curious.
Yeah.
What's the breadth of areas that you have in your practice?
Absolutely. So as a facial plastic surgeon, I'm an expert in everything from the collarbones up. So if you have something that you want me to take a peek at on your tummy, I may throw you a bone and look at it and go, oh yeah, I think I know someone for that. But I really believe in being a specialist. And so anything from the neck up, I'm your girl. That can include everything from surgery all the way to like skincare consultation. Because as we've kind of talked about here, it's finding where you are in the journey and making that partnership. I have someone who just like, maybe for whatever stage in their life, the quote unquote right answer, maybe that a facelift would get them the results they wanted, but they just don't have the bandwidth for downtime or going through surgery or anything. So we can customize to make sure they still walk away with this sense of empowered self-image and confidence and all those sorts of things. So skincare, injectables, lasers, peels, surgery, the whole thing basically from muscle out, from the
Amazing.
mind.
What is your favorite new technique that's out there right now for anything like skin rejuvenation or care? And it doesn't matter what category it falls into, but what's like your favorite that you're seeing?
Yeah. I'm just still getting so excited for what we're going to have in terms of regenerative medicine, right? That's going to be the name of the game. For years, we've kind of had PRP and PRF. And for those of you who don't know, that's borrowing some cells from the blood to stimulate other cells in different areas of our body. But it comes with limitation, to bring it home. If someone's nutritional status is poor, they're not going to have a ton of stem cells or like precursor cells in their blood.
Mm.
And so the next frontier is just going to be really finding ways just to help make people truly like have healthier skin, right? So where beauty and aesthetics and some of that tension can lie of like, do we have to be doing this? Should we be doing this? Of like, well, no, we're actually giving back to your body healthier skin, less skin cancer, less everything. So those include some of the things like exosomes, like growth factors and stem cells, and just getting also maybe more equal standardization of those products in the market.
Very cool. Awesome. I love hearing about this. I don't know a ton about it, but I do know that you do some surgery for kids.
Oh yeah.
Yeah, you want to share just a little bit about that? Because I think it's
I
awesome.
do. Yeah, absolutely. So one of the important charities that I work with is called Healing the Children. Think of them as like a smaller organization parallel to like Smile Train or some of the other cleft lip and cleft palate missions that exist in the world. And basically, it's just such a beautiful organization because they go and pro bono anesthesiologists, nurses, surgeons, and support staff donate their time and travel to different countries across the world to perform surgery.
Mm.
And the one that I go on, we work in Santa Marta, Colombia, and spend a week reconstructing cleft lip and cleft palates for the children of South America. And it is the coolest. It's so wonderful. I
That's
love
so
it.
amazing. That's amazing. And for those, and this is again my curiosity, for those individuals having that surgery, what does that provide for them,
Absolutely.
like
So
for their life?
it's life changing. So it goes back to kind of the things we talked about of like stigmata and people just noticing, right? For better or worse, the human eye was trained to notice discrepancies and variants of what we call average or normal. So
Mm.
there's at least that like social stigmata of having a cleft lip. People stare at the children and, there's people have emotions about it, whether they're positive, negative. We don't always get to control those sorts of things.
Mm.
So there's that. The other things, there's a lot of functional. So sometimes, if they have a lip, they can often have a palate. And babies in particular need that hard palate to like suck and swallow, right? If we as adults need to chew, we can use our teeth and kind of push food to the side. But a cleft palate means there's a connection between the roof of the mouth and the nose. So they're very inefficient at breastfeeding or bottle feeding, and that can set them up for poor growth, wound healing, infection, illness, all of that. They just don't thrive as well. So it
Mm.
kind of balances again form and getting to a function where they're just their happy selves without any extra attention.
I love that so much. Thank you for that's amazing that you do that, obviously. And I really appreciate just your explanation about how that impacts individuals for their life and what an incredible gift that you can give them as a surgeon in that way.
It's the best. That organization, they do such a great job. Like the team members, some of these nurses have been on like 30 missions. Like it's their hop. They're the coolest.
Wow, that's so cool. I love that things like that exist.
Me too. We need it.
Absolutely love it. Okay, well, this has been awesome. Such a pleasure. Thank you so much for joining. And before we kind of sign off, is there anything else that you feel like we might have missed that you want to make sure that we share here?
Oh my gosh, yeah, we could do this like for the next 3 hours. And be like, oh, forgot to talk about this.
Yes.
One of the things I loved is that you wanted to kind of cover of like, hey, what if someone's considering surgery but haven't really thought much about like the process or how nutrition and movement fit in? Like, what's the number one thing you want them to know? And this is maybe more a lesson for myself that I need to remind is that it's time just to start considering it now because you're not going to burn any bridges.
Mm.
You're even considering surgery, it means you're in the realm of getting ready. And it's our minds always overestimate what we can do in one singular piece of time and underestimate those little steps that it takes to get there and how much we can accomplish over a long-term view. So if it is something where like, hey, you're walking a few times a week, but not really building up your strength, well, sometimes a surgery can be that like kind of milestone that you're striving for to make a
Mm.
change. So those like little steps taken to improve surgical outcomes, luckily, are the exact same outcomes that improve like our other areas of our lives, like improving sleep and your immune system and your mood and anti-aging and all of those things. So it's kind of like getting that ready to go. And then to brag on another favorite patient that's not you, but she's darling and you guys would be delightful. She had tried to quit smoking 27 times. She had done medication, she had done hypnotherapy, she had counseling, she had everything. And she had surgery with me, purely aesthetic. And it was because I talked to her about wound healing for surgery that she said, all right, I'm laying down the cigarettes. This is worth it to me. I want my best result. And we are a year and a half later, and she has not smoked since.
That's
Isn't that the coolest?
amazing.
So it's the
Yes.
little things. It's all tied.
Okay, well now you're reminding me of thank you. Yes, 100% yes, because the body has to have the appropriate foundation to be able to do what it's going to do to effectively recover from surgery in the best way possible. On that note, I don't think if I shared this with you, a little over a year prior to the surgery in January, I had stopped drinking alcohol.
Mhm.
And about 3 years prior to that, I had stopped vaping. So there was this whole, and I had this whole experience with vaping. Wow, you guys do not start. It is the hardest thing to stop.
The hardest.
The hardest. Yeah, that could be a whole other thing. And most of our clients that listen to this, they'll be like, what, Shannon? And yeah, that was the thing that was happening in the background.
That was real.
Yeah, now you know. But I was so grateful, and it wasn't planned this way, but I had given my body a year to not have alcohol in the system. And alcohol is so highly inflammatory. And so, of course, that's one of the recommendations that you don't drink alcohol and obviously smoking. And so I love that you shared that. But what you're sharing is that, yeah, surgery can be like the race day that you're going to have or the event that you're preparing for. It's literally like you can start now when you're thinking about it and start preparing your body's foundation for health so that as you're going through surgery, you have the best possible toolbox for your body to pull from for recovery.
Perfectly said. Absolutely.
Thank you for saying that because
Oh,
it's such a key component.
yeah,
And
it's
most people don't even think about the prep.
I know. I probably didn't for too long, and now it's really on the surface and on front of mind.
Yeah, I mean it's like the most important. Also something that I did which I was planning, not really planning, but it happened in perfect timing is the week before surgery, I had a lot of filming for strength training.
Oh,
So I got to basically have like a full week of pretty dedicated like inflammatory responses and then 4 days prior where I didn't work out at all before surgery, which essentially from my understanding and from what I know with my body, it allowed me to maintain my strength for longer, because what happens when we have any sort of movement practice, when we take 2 weeks off of a strength training practice, we'll lose about 25% of our strength. If we take 2 weeks off of a cardiovascular practice, we lose about 50%.
Wow.
And to rebuild it, our cardiovascular capacity can actually come back within 2 weeks. Sometimes strength takes a little bit longer depending on how you get back into it. But because I have that awareness, I was able to prep ahead of time,
Amazing.
make sure that that wasn't missed, and then understand when I would need to likely start to introduce strength training back to mitigate the losses that I would have sustained.
Amazing. That's a perfect, like you said, build a foundation that then you can launch from.
Yes. Yeah. And everyone's going to be different, of course, but that was my personal understanding of my body and where it was at. So, anyways,
Brilliant.
amazing. Thank you so, so much. This was such a treat.
Yeah.
And for those of you who are listening, I can't recommend Dr. O'Connor highly enough. If you are in the Nashville area or otherwise, and you want to fly in and have that experience, she has been absolutely amazing. And I feel so grateful that I followed my intuition and waited, and that we found each other. So any last words before we sign off?
No, just the gratitude is mine to get to know patients like you and be on this journey is everything. So I couldn't do it without you. And I'm so proud and thrilled.
Yeah. Awesome. All right, everyone. Thank you so much for listening, and we'll see you next time.